physio TV. So someone's hurt their knee. You might hear them talk about, I've done my cartilage, or you might even hear the term meniscal tear. But what does it mean? Well, first, let's have a look at the anatomy. So here we have a knee. It's a right knee. If we look at behind the kneecap, so I'm just taking that kneecap to one side, dislocated kneecap, ouch. What we have is two C-shaped structures within the knee that increase the depth of the knee joint and also provide lubrication and smoothness. They are the menisci. We have the medial meniscus, which is towards the inside of the knee, and we have a lateral meniscus, which is towards the outside of the knee. Now, these structures help to increase the smooth movement of the knee joint itself, and if there is an injury to those structures, that can be really, really painful. Quite often it's done by a twisting injury, so a twist to the knee under load causes a small notch to appear or tear off within the actual nice smooth meniscus, and that results in, every time we bend and straighten our knee, an irritation and a pain. It can be really uncomfortable. It's quite hard to diagnose yourself. Knees, when you injure them, whether it's a ligament injury, say one on the inside or one on the outside, or just an injury that causes an inflammation within the knee, can be difficult to distinguish between an actual meniscal tear and some other injury. The sort of symptoms we get with a meniscal injury are pain, locking, but not always, some kind of catching, but again, not always. Often there's no swelling there, which can be a bit of a giveaway because the meniscus actually has a relatively poor blood supply. And so you only really get swelling when you injure something that's got quite a good blood supply. One of the things about the pain is it feels deep within the knee. That's a really distinguishing factor. It's because quite often if you've injured a ligament on the side of the knee, it actually feels quite on the surface. You can actually isolate it, and you can often find a place on the knee which you can press, which is sore. When you injure a meniscus, it's quite deep, and that means that it's quite difficult to localize, and it feels deep within the knee, and often poking and pressing around the knee produces no symptoms, no soreness whatsoever. That's a real giveaway, a really key symptom in the terms of trying to diagnose whether we've actually injured a meniscus or whether we've just done some other kind of strain to the knee. It's very simple. We need to be comfortable, so as comfortable as possible. So that involves, relatively speaking, rest in it. We don't want to necessarily increase our activity to try and work through it if we think we might have injured a meniscus. But using ice, rest, sometimes ice helps if it feels very, very sore, but actually the actual problem, of course, being deep within the knee means that it's not going to have too much direct effect on the meniscus. It's just going to almost be a bit of a distraction. We want to maybe take some pain relief, obviously prescribed by a doctor if necessary. If you want to see some of the video that I'll do on topical rubs, then sometimes that can be helpful, but again, it's quite deep within the knee. If it is a meniscal injury, it's not going to do an awful lot to the actual meniscus itself. Well, we want to just do some limited range of movement exercises in a relatively pain-free range. So whatever we can move without it being too uncomfortable is acceptable and needed, because we don't want to get too stiff in the knee. But at the same time, those movements should not be acutely painful, all right? They should not be acutely painful. We shouldn't be going through that range of movement if there's a catching sensation or a locking sensation. We want to, relatively speaking, rest it from that. What we will know is that we'll know a bit more in 2 or 3 days after an injury. So 2 or 3 days after an injury is when it's settled down a little bit, and often If it's a less severe injury than a meniscus, it will have settled a little bit. But quite often with meniscal injuries, it won't have settled at all, and it'll be locked up still, really, really painful, catching sensation. And it's those points when it's a good idea to maybe go and see a doctor or a physiotherapist who will be able to do some movements and tests to try and give a gauge whether actually there's a likelihood that meniscus has been injured. The only real true way to find out whether a meniscus has been torn is through MRI scan or arthroscopic surgery, but commonly that's a bit extreme to go straight into. An MRI scan will show the cartilage, it will show the restriction within the joint. An X-ray won't show that. An X-ray will only show bony alignment and bony changes, whether there's arthritis and things like that. The cartilage only shows up on MRI scan. So the only definitive way to see is whether there is to have an MRI scan. And so if the knee joint problem doesn't settle in over a few weeks and it's still not getting better, it's still catching, some of those symptoms are still the same, then unfortunately probably the best thing to do is get referred to a specialist and then have an MRI scan just to confirm the likelihood that there's a cartilage tear. Really, the only way to get better from a real cartilage tear is to have that portion of the cartilage just smoothed over through arthroscopic surgery. So the doctor will do that. Really can't say arthroscopic, but you get the idea. Arthroscopic surgery, keyhole surgery into the knee, smooths off the joint surface where there's been a notch, where there's been a tear, and that's a relatively simple procedure. It's often a day procedure these days, and quite quickly, within a week or two, we're functioning again in a relatively high level of activity and even exercise. So I hope that's been some interesting and informative information about meniscal injuries.